Thanks a lot, Mark. In the Fox 6 Health Center this morning, we're talking about sleep apnea and snoring and a simple and minimally invasive procedure to treat them. That is. Joining us to talk about the pillar procedure is Dr. Madan Kandula with St. Joe's Regional Medical Center. We've talked about sleep apnea. We know what that is. When people stop breathing, they're not having, the best sleep that they can.
Right.
But there's a way to treat that another way. Let's talk about pillar.
Right. The pillar procedure, it's relatively new. It's only been around for the last year and a half or so. And what that involves is actually implanting 3 little implants into the soft palate, which is the area just above the little punching bag in the back of the throat, which is called the uvula. And that actually stiffens up that area and gets rid of snoring for most people.
Now, do you feel the difference with those implants?
You don't, well, I should say you do initially. When they're first implanted, you can kind of feel that there's something back there for about a day or so. The true effect of the procedure happens as your body reacts to those implants, and it's a natural, your body's reaction to that is in the form of a stiffening to the palate.
So you're implanting something. I would imagine that there is scar tissue. That has any effect on your taste or anything else?
No effect on the taste at all. And it is actually, it is scarring. It's fibrosis is what we call it. And what that is just a stiffening process. The material itself is actually a suture material that's been around for about 50 years. So we used it commonly for suturing wounds and things like that. So that's been known. It's been implanted in the body for a long time. But this new application is what's been really remarkable.
And it's working?
Yeah, absolutely. It works for about 80 to 90% of people who have snoring.
And how long?
As far as when does it start working? It starts working typically about 3 to 4 weeks after it's implanted, and the implant stays in for life. It can be removed if necessary, but that's extremely rare.
And if anyone lives with someone who snores, or they themselves are a snorer, it's more than just the loud disruption. I mean, we really are talking quality of life, because when you don't get that sleep day after day after day, it really starts to affect your health, your mental outlook, everything.
Yep, absolutely. And it's not just the person who snores, it's more everybody in the room, in the house, and everybody kind of gets grumpy, basically.
So what, are there people who are like not good candidates for this procedure? There
are people who have severe sleep apnea and other issues anatomically that would better be served by other procedures. So it's one piece of the armamentarium that sort of goes against sleep disordered breathing.
Sleep disorders, we're hearing a lot about it because a lot of people have them.
Correct.
Dr. Kandula, thank you so much for being here.
Thank you.
It's 8:22 and still ahead this morning. Take this job and